Hello, and welcome back to Nurses Notes 101. Today we'll be talking about cardiomyopathies. We're going to be talking about what is a cardiomyopathy, the types of cardiomyopathies, risk factors for each of them, how to diagnose them, side effects of each cardiomyopathy, treatments for them, and nursing diagnoses. For one, a cardiomyopathy is a group of diseases of the muscle layer of the heart, the myocardium. Cardiomyopathies are frequently associated with coronary artery disease, hypertension, cardiotoxic agents or drugs, valve disorders, and pulmonary disease. There are 3 to 4 different types of cardiomyopathies, and they're classified by etiology and the abnormal physiology of the left ventricle. The 3 that we're going to be talking about today are dilated or congestive cardiomyopathy, hypertrophic cardiomyopathy, or restrictive versus idiopathic cardiomyopathy. Dilated cardiomyopathy is when the ventricle itself is dilated, which impairs systolic contraction. Due to this dilation, the blood tends to pool in the ventricle, which commonly causes clots. Dilated cardiomyopathy is the most common type, and many times these patients are on anticoagulants to prevent these clots from becoming bigger problems and causing strokes or heart attacks. Hypertrophic cardiomyopathy is characterized by myocardial hypertrophy, which makes sense, right? So there's no ventricular dilation here, but the muscle itself is enlarged. So while the ventricle is the normal size, the muscle is larger. So sometimes due to hypertrophic cardiomyopathy, it can or cannot obstruct the left ventricular blood flow. Obviously, if the left ventricular blood flow is obstructed, that's more of a problem. The next 2 types of cardiomyopathy I'm going to talk about are restrictive or idiopathic cardiomyopathy. In certain articles, we'll see that they describe them separately. So some people say there's 4 different types, but most of the articles I've come across, and to keep this a little bit more simple, they put them together, and there's just 3 types of cardiomyopathy. So for these purposes, I'm going to group them together. But in restrictive cardiomyopathy, instead of the ventricle being dilated or the muscle being enlarged, in restrictive, the ventricle is actually more rigid. There is a decreased diastolic compliance, and the ventricular cavity is smaller. A lot of times, the signs and symptoms of restrictive cardiomyopathy look like pericarditis. Signs and symptoms of cardiomyopathies across the board are pretty similar. A lot of times they do look similar to heart failure. So, jugular vein distension, dyspnea, fatigue. There can be conduction disturbances due to the thickening of um, ventricular walls, thickening of the muscle itself, or the stiffness of the walls. Mostly, and what we would hope for is there is a benign onset for cardiomyopathy, or sometimes they are congenital. But sometimes, as we see with athletes, there can be sudden death. Those issues that we're seeing sometimes in athletics is due to hypertrophic cardiomyopathy. Commonly, as well, a sign and symptom of cardiomyopathy is tachycardia or irregular heart rate. And depending on degree of heart failure in patients, the blood pressure is either going to be high or low. So if they're in the early stages of heart failure, usually it'll be high. If they're in the later stages, when they're in more of a cardiogenic shock, uh, Arena, the blood pressure is going to definitely be lower because the cardiac output is less. We can see murmurs with these patients, like an S3 gallop as well. Risk factors of cardiomyopathy include genetics, cardiotoxic agents, and then there are some specific risk factors for each type. Um, to start off with hypertrophic, usually, I think it's over 80% they say it's genetics. Um, Most of the dilated cardiomyopathies are actually from viruses. So the herpes virus, the cytomegalovirus, Lyme's disease, um, pregnancy-induced dilated cardiomyopathy or peripartum is a thing. It could also be caused by hypothyroidism or a lack of thiamine. On the other hand, restrictive cardiomyopathy can be caused by the medication that's commonly given for lupus, hydroxychloroquine, sarcoidosis, amyloidosis, radiation therapy. So, some of the things that we take to help us and to treat us can actually cause these cardiomyopathies. Cardiomyopathy is most commonly diagnosed with an echocardiogram while also noting the patient's history and physical assessment. The physician's also going to want to assess their cardiac output and see how advanced the cardiomyopathy is. Um, EKGs will definitely be performed to note for any arrhythmias that the cardiomyopathy can be causing, a stress test to see how it reacts when the body's under stress. An X-ray can also be done. I'm sure it would probably show enlarged heart. A cardiac MRI, cardiac CT can also be done as well. Side effects of cardiomyopathy, there's a lot of these. So, like I said before, many of these patients are prone to developing clots due to the stagnant blood in the heart. So many times they're on antiplatelet medications, anti-clotting agents. Oftentimes, these patients will also have valvular heart disease, which will progress to more progressive heart failure. Other side effects include atrial fibrillation, which can lead to sudden cardiac arrest. Um, these arrhythmias can become ventricular, which would lead to a torsades, which can cause cardiac arrest. Um, Heart murmurs can also develop in these patients. Let's see, like said before, hypertrophic cardiomyopathy is the most common cause of sudden death in men under 35. And then the most common side effects that we'll see nauseousness, vomiting, fatigue, having to sleep with a few pillows, so orthopnea, jugular vein distension, dependent edema, ascites, enlarged liver, similar with heart failure, and loss of consciousness. Ways in which we treat cardiomyopathy um, depends on degree of heart failure. So the goal of the treatments that we provide is to relieve symptomology and ensure we have an adequate heart function, preventing cardiogenic shock. To treat heart failure, let's say if the patient's headed towards a shocky state, we're going to want to give an inotrope such as milrinone or dobutamine. To rid the patient of excess fluid that can develop when the heart isn't pumping adequately from heart failure, we can give diuretics. If the patient winds up developing arrhythmias from the cardiomyopathy, we can give beta blockers or ACE inhibitors. Let's say these medications aren't enough. They can go under the knife and get a pacemaker implanted, be cardioverted, um, which is less invasive. That's just subcutaneous through the pads, or have an ICD implanted. Like said before, anticoagulants would be ordered to prevent clots from that blood stagnation. And then let's say the patient has cardiomyopathy for a while, their ejection fraction is poor. Let's say it's between 10 to 20%. There's not really much else that the physician can do. So a cardiac surgeon intervenes, and they're either offering the patient a left ventricular assist device or an LVAD or a heart transplant. These both come with risk reward, but these are sometimes the final option for patients. The most common nursing diagnosis that come to mind for patients with cardiomyopathy would obviously be decreased cardiac output due to these genetic issues, viruses attacking the heart, and the physiological abnormalities of heart structures. It causes the heart to have decreased cardiac output. This would also cause impaired gas exchange and sometimes acute pain. Positive outcomes that we would be looking for in patients with cardiomyopathy. So, for us to see that the treatment is heading in the right direction, we want their capillary refill normal, which is less than 3 seconds, a normal intensive blood pressure, so systolic from 90 to 120, a normal heart rate of 60 to 100, a urine output of at least 30 mLs an hour, or it's not 1.5 kilograms an hour, zero point 0.5 mLs per kilogram per hour, I'm sorry. And then we want the CVP between 2 to 6 millimeters of mercury. If the CVP is higher than that, it could mean that they're becoming overloaded, which could mean they have a component of heart failure. Okay, I hope you liked this post about cardiomyopathies. Please hit the like button and subscribe to my channel. There is an icon right to the right, which is an automatic subscribe button. So please click it. Thanks for listening.